They're vaping, not smoking, and they're not alone. New figures today show the number of people using e-cigarettes in the UK has trebled in 2 years to 2.1 million.
I smoked for years, and this is potentially better for you, I guess. You know, you haven't got any tar.
When you're smoking an e-cig, you just get just nicotine and nothing else.
Despite the enthusiasm here, the British Medical Association and the World Health Organization have recommended banning e-cigarettes in public places. They say there isn't enough evidence that they're safe or effective. Queen Mary University in London. Ian is having the levels of carbon monoxide in his body tested.
That's showing a 4 there, so that's a non-smoker reading.
Ian now uses an e-cigarette. It works by heating liquid nicotine into a vapour, which is then inhaled. The test is overseen by Professor Peter Hayek.
Many people out there think that nicotine itself is a dangerous poison, but if nicotine is taken without the accompanying toxicants, then the health effects would be very similar to drinking coffee.
That's a 4, so that's the exact same reading as before the e-cigarette.
So e-cigarettes contain no discernible toxins or carbon monoxide. The final test, what reading will Ian get after having a normal cigarette?
So you've got a 10 there, so that's officially a smoker reading.
Experts say e-cigarettes are orders of magnitude safer than normal cigarettes, but do they work? Professor Robert West is one of the country's leading addiction experts. He studied 5,000 people who were using different methods to try and stop smoking: patches, gum, e-cigarettes, and nothing. His results are published next month.
What we found was that those who were using the e-cigarettes were about 60% more likely still not to be smoking than those who used either the licensed product or nothing at all.
Despite that evidence, serious concerns remain. Does the marketing of e-cigarettes make them attractive to children? One study last year found 12% of 14 to 17-year-olds had tried them.
We already have data which can actually check this worry. If a child tries a conventional cigarette, there's a 50% chance that they will become daily users. If a child tries e-cigarettes, so far we have no evidence that they progress to regular use.
There are other worries. The Welsh Government says e-cigarettes glamorise and will renormalise smoking. They've proposed a ban in enclosed public places.
No question of someone, looking at someone using that and thinking they're smoking. So you've got to think, well, okay, so it's not dangerous to be near someone who's using an electronic cigarette. There's really no evidence and actually very little reason to believe that it's going to renormalise smoking. So what's the problem?
The problem in the end may simply be the word e-cigarette, the vapour that looks like smoke, a sense that they just don't feel right.
I can understand people wanting to be cautious, but if we fail to take this opportunity that electronic cigarettes potentially are providing, then we're really condemning people to death who would otherwise have lived. That's what's at stake.
Nonetheless, regulators are clamping down on e-cigarettes. Concerns remain about safety, efficacy and limited regulation.